So I'd like to cover first radiomics and texture analysis. What is it and how we do it and why are we doing it? And then I will also discuss machine learning and deep learning evolving applications in liver imaging. So before we even delve into this, an important topic in oncology is what we call intra-tumor heterogeneity, right? And we know that any tumor in the body in humans is very heterogeneous. It has different components sometimes. It has different, blood flow. It may have different molecular signatures. And this is really important because it determines prognosis and treatment response. And this is really a significant challenge, actually, in oncology, especially when you think about it. When you do a biopsy, you really are limited by the sampling error. When you do a biopsy, you can really go to areas with low grade or high grade, etc. And also what's interesting is that metastatic lesions can be very different from the primary tumor. You may have very different phenotypes. And what's interesting about imaging is that you can really assess the whole tumor and give a more kind of quantitative way of looking at tumor heterogeneity. This is an example of a phenotypic heterogeneity with imaging in a liver cancer case that's kind of very magnified, and you can see significant, heterogeneity in blood flow. This is DC MRI here, where we inject contrast and we keep imaging every approximately 3 to 5 seconds for multiple minutes. And you can see that, for example, the anterior portion of the tumor is very well vascularized, while the back is more kind of low flow, hypoxic. We also look here at the oxygen uptake with R1 or T1 and T2 star. And same thing here. You're going to see opposite of DCMRI with some differences in hypoxia levels. But anyway, so the point is to show you that, yes, I mean, if you were to take an average of this, it will really kind of mix up all the findings, and you really want to be able to get a meaningful way of expressing this tumor heterogeneity. So one of them is, of course, spatial, maps. Basically, we can really kind of map out the differences visually, but you want to be able to do this in a quantitative way as well. So initially, the word radiomics has been coined by our colleagues in RadOnc, actually, in radiation oncology, but it's been kind of adopted by imaging scientists mostly. And what is radiomics? So radiomics is basically the way where you extract some quantitative imaging features from routine images, whether it's CT, MRI, or ultrasound. And then usually looking at large data sets, mineable data sets that can be used to build predictive models that relate, imaging features to either outcomes, pathology, genomics, etc. And it's also a good way to assess intra and intertumor heterogeneity, meaning, inside the tumor but between patients, where you identify what we call habitats or subregions within tumor.